as Laura mentioned, we will be reviewing the Phase 1 contracting partner reporting process today. And so our ultimate goal today is to make sure that we answer any of your questions. You do have other available resources, as Lauren mentioned earlier. Your reporting guide, your project activity schedule. We'll be going over a detailed example of how to fill out the reporting templates that you all received. And as well, if you all do have any questions along the free to send us through the GoToMeeting chat. We can start, taking those questions, looking at them, so we make sure we answer those. And then, of course, there will be time at the end of the webinar for questions as well. So this is our agenda today. We will be doing a general overview. Want to cover the information that is just some highlights from your reporting guide that's been made available. Go over the supporting documentation, the different types, some examples of the templates that AMCH PPS has provided to you. And then again, as I mentioned, going through a step-by-step reporting process example with you all. So just to start off with some general highlights, a reminder that you partners do have to report on all the metrics that are listed in your Exhibit A's for the applicable reporting period. We'll be going over the timeline as well for the reporting periods, but we do have 3 reporting periods in Phase 1 contracting. And you all should have received these Exhibit A's as part of your contract with AMCH PPS. So that information, all your metrics are listed there, which are based on your project participation as well as your partner type. Please keep in mind that some of these metrics will require monthly or quarterly submissions. That information is also available in your reporting guide, and we'll also go over some of that in more detail later on in this presentation. You will be awarded your eligible allocation payments based on your ability to demonstrate completion of the applicable metrics for your selected project. So that is why this partner reporting process is very important. This is the way that AMCH PPS will be able to confirm and verify that you've completed the activities that are listed in your Exhibit A so that you can receive your payments for Phase 1 contracting. You should have already received your individualized partner reporting template via email from AMCH PPS. And so if you have not, as Laura mentioned, please reach out to her after this webinar to make sure that you do have that template available to you and the appropriate team members on your team. As a quick reminder that AMCH PPS did complete all the reporting activities for partners in 1, and so we will go through what that'll look like in your reporting template as well during our example. So with the templates that you all have received, you will see that reporting period 1 has been completed, and you will essentially be receiving the credit for that particular metric. As I mentioned, you have the resource, your project activity schedule, which is attachment A of your reporting guide. This has been made available to you in PDF format and also Excel so that you can easily filter for your appropriate projects. And all of your supporting documentation can actually be found in that project activity schedule. A note is that this project activity schedule is your ultimate source of truth. So because there have been some changes with due dates from the state, et cetera, just timing-wise, there have been some updates to completion dates that may be different from what you will find in your reporting template. So just keep in mind that the ultimate completion date and reporting dates are what is found in your project activity schedule for your projects and metrics. Even though we do have all the supporting documentation detailed out in the project activity schedule, we just also want to know that AMCH may require some additional supporting documentation, such as email notifications of participation in webinars, trainings, etc., perhaps within 24 hours of participation. And it is at their discretion to also request additional supporting documentation. And so if that is so, they will let you know with enough time. So this is the Phase 1 reporting template, reporting timeline that I was talking about. So essentially, Phase 1 has been divided up into what we call 3 reporting periods. Within these reporting periods, you have completion dates and your expected payment periods. So as I mentioned, reporting period 1 has already been completed, and that process was completed by AMCH, and so they have already reviewed any documentation that was provided to them. They have already essentially what we call graded your reports. So that has been done. The expected payment period for this reporting period that ran from August 1st to August 20th is between August 20th to September 1st. So it's, of course, there are still some payments going out, flowing to partners. And so AMCH is responsible for making sure that those payments get to the partners based on their completion. Then the next reporting period for the completion dates for that reporting period is August 1st, 2016 through October 31st, 2016. And the reporting period for that is November 1st through November 10th. So November 10th is essentially the final due date for everything to be complete. And you have to have submitted your reporting templates by then with all of your supporting documentation for that time period. Then there will be a remediation period from November 10th through November 15th within reporting period 2, where AMCH reserves the right to request additional information from partners to actually receive credit for completion of your metrics. So November 15th will be the final date where you can submit any additional information as requested by AMCH for reporting period 2. And again, your expected payment for period 2 will be within November 20th to December 1st of 2016, again, at the discretion of AMCH PPS as to when those final payments will go out. For reporting period 3, your completion dates will run from November 1st through December 31st of 2016. And just to backtrack a little bit, what your completion date is really just that time period between, during which your metrics have to be completed for that particular reporting period in order to trigger payment. So this reporting period 3 will run from January 1st through January 10th. So as a partner, you will be, again, have to complete your reporting templates and all supporting documentation uploaded and to AMCH by January 10th of 2017. With the remediation period between January 10th through January 15th, and then expected payment, again, from January 20th through February 1st. And just as a note, if any of the due dates do happen to fall on a weekend or holiday, all the requirements will be fulfilled no later than the following business day. So if, for example, the 10th happened to fall on a Friday, everything would be due the following Monday immediately by end of business. Here are some key dates, again, deadline. So all of the partners should have signed their contracts and submitted to AMCH PPS by July 29th, 2016. September 14th is when y'all should have received your reporting templates via email. Again, if you have not, please do reach out to Lauren Ayers, make sure that you get those. November 10th will be the first, essentially the first actual reporting period for U.S. partners where you will be submitting your templates and your supporting documentation for reporting period 2, with November 15th being the final date for submission of any remediation request. Any additional information that AMCH requests from you will be due then. And your reporting period 3 will be January 10th, 2017, with the remediation period ending January 15th. For reporting period 3. What we do want to call out is that you do have some metrics such as patient engagement and impact analysis, data registry, such that if you if those are applicable to you based on your, again, project selection and your partner type, there might be quarterly and monthly reports that must be submitted 10 days after the completion date listed in the project activity schedule. So just a reminder that even though payment might not be triggered until, let's say, reporting period 3 for that particular metric, you do have to continue submitting your monthly and quarterly reports in order for that metric to be considered complete. Again, we'll go over some of those examples so that you can understand how that process would work. So every reporting period, there are essentially 4 key items that will have to be included in your reporting documentation. You will have to have a signed and dated reporting attestation cover sheet, which is found is a tab within your actual reporting template. You will also have to submit your completed partner reporting template, which is the Excel file that you all should have received. And this will, with all the information for the appropriate reporting period. You will have to complete any templates that you received that AMCH has provided for particular metrics. So again, if those were submitted on a monthly or quarterly basis, you will have to make sure that those have been submitted on a monthly and quarterly basis. There are also some templates that can be used. The same template can be used for several metrics. And so an example of that would be your patient engagement template, where if you have several projects that you're reporting patient engagement for, you will not have to create separate templates, but instead you'll be able to use that one, and you'll be able to upload that with your supporting documentation. So we'll go through that example as well. And then finally, any other supporting documentation that is required that may not have necessarily come in the form of an Excel template or something from AMCH, you will have to PDF all those documents into one document for the specific metric. So, for example, if I have a metric that requires an agenda, meeting notes, and a sign-in sheet, you would have to combine all of those into one PDF, and then you'll submit that as your supporting documentation for that one metric. This is just a quick overview of essentially how the reporting workflow would flow. So you, of course, have received your email with your individualized partner reporting templates. Your applicable metric templates will have either been emailed to you, or they will be available on the website that we listed at the end of this webinar, and also in your reporting guide. You'll be able to find all the templates that you need for your applicable metrics. So you'll want to make sure that you fill out your metric templates as applicable for the time period that you need to fill them out for. You'll have to gather all your any additional supporting documentation for each metric. You'll want to make sure that you package all your information, your documents, into one single PDF file for appropriate metrics. Please don't PDF any Excel templates. If there are Excel files that you're using for supporting documentation for some reason, please do check with AMCH if they prefer for you to PDF it or not. But for the most part, everything that they're requiring Excel files for, they should have provided a template for already. And you'll want to make sure that you fill out your partner reporting template. Again, it'll be that Excel file that you all received. Make sure that it's completed. Perform quality assurance on your documentation and also on your reporting template. Make sure that everything is accurate. The information that you're providing is correct. And you will need review from your reporting liaison and quality assurance officer. So you will see that on the attestation cover sheet, we ask that you identify a reporting liaison and a quality assurance officer, and these individuals do have to be different people, just to make sure that you are attesting for your organization that the information you've provided is accurate. So then finally, you will submit all your supporting documentation, your reporting template, and your signed attestation to AMCH using MoveIt. Anything that you see here in the red boxes is the process that you will have to essentially go through for every reporting period. And so again, we will be going through this workflow as an example with you. And then once you complete it, as I mentioned, you will upload to MoveIt, and we will also be going through an example of that with you later. Now we're going to review just some of the high-level supporting documentation requirements, some of the naming conventions, and what that would look like. So as you are saving your supporting documentation, we do request that you please use this naming convention that we are providing here, and also in your reporting guide, where you will also find additional examples. This really helps AMCH gather all the documentation, easy to find, make sure that it's being saved accurately, and it's assigned to the accurate metric by appropriate date. So for the Excel templates that you did receive, those all should have a template name. They should have been, as I mentioned, emailed to you or available on the website with a particular name. So the way that you would name those files would be with your partner name. In this example, we have ABC Hospital, underscore your template name. In this example, again, patient engagement template, and then underscore completion date in month, day, and year format. So here, your completion date for this particular patient engagement template was for your 6/30/2016 submission. So that is the completion date that you would use for the end of this supporting documentation name. Then any other files, such as I mentioned earlier, your PDF files, you will want to save with your partner name, underscore your metric ID, as you see here. So as it's also spelled out in your Exhibit A and in the project activity schedule. So it would be 2.a.iii underscore P6, because it is for metric P6 for project 2A II. And your completion date, which for this metric it was to be completed by 9/30/2016. These are just some additional examples. This is also available for you in the project activity schedule at the end of your reporting guide. You will be able to see that you have all the information that you need for the particular metrics that are applicable to you. You see also this is the completion date that we keep referring to, how often you have to report, and this is what essentially that documentation file name would look like once you're entering it into your reporting template. So you see here that you had a metric that required quarterly submission. So you have listed all of your quarterly submission, what the title, the name of that file was. And you see here that we use the same, essentially the same document, different dates, of course. And if you had another patient engagement metric, for example here, you would have used this exact same information, but making sure that it was also listed in your other metric supporting documentation column in your template. So this is just to serve as an example for you all. Again, is basically the naming convention that we're looking for, and the same thing for any monthly submission. You see here that it is your completion date, not your reporting date that you're using at the end of the file name. Your reporting attestation page, this is what I was referencing to right now, where you will need to assign a partner reporting liaison and a quality assurance officer. It's really important because it does facilitate the oversight that's required by the New York State guidelines and reporting requirements. It allows you as an organization to attest to AMCH that you are providing accurate and valid information, and that your supporting documentation is correct. It's only required one attestation cover sheet per reporting period, so you will be submitting one with reporting period 2 and one with reporting period 3. This will also be saved as a PDF, and it is a tab available in your reporting templates, and you'll submit that to move it with your final submission. So who are your partner reporting liaisons and your quality assurance officers? So really your partner reporting liaison is the internal primary point of contact for reporting purposes. It might be the contact that your organization already has right now for DISRIP, but it's really essentially like that project manager that is responsible overall for making sure that reporting gets complete and what's ultimately going to draw down those funds from AMCH. And you have your quality assurance officer. It's an internal officer who will sign off on the reporting period submission and attest that, again, the documentation has been approved and is ready for submission. We want to make sure that somebody is reviewing the documentation, making sure that dates are accurate, it meets the minimum requirements, also keeping an eye out for PHI where there should not be any PHI. So it's just that additional set of eyes with that also accountability tied to it. As we've been discussing, there have been some templates that have been provided by AMCH. There are specific templates for specific metrics and within specific components of the reporting process. So for reporting metrics, for IDS R8 and IDS R9, you have been provided some templates. So IDS R8, you will find an impact analysis template for that metric, and a training template for IDS R9 for the asthma training of evidence-based asthma management. And Zoe will be going over some examples of the impact analysis and training templates, how those should be filled out so that they will ultimately be completed and submitted to AMCH. You have an engagement metric, IDS E10, which also requires a training template to be completed as supporting documentation. And then for your performance metrics, you have all of your disease registry metrics and your patient engagement metrics will have templates that go along with them. And you will have a training template for 3BIP6 and 3BIP8. And finally, AMCH did provide an attestation template. This should be used as a template for any time where you are attesting that you have completed a particular metric. And so that one has been provided as well. It's more of a guide as what should be included and how it would look. And I believe that AMCH actually provided two metric examples for that one. And again, this is if there is any other metric where you're just attesting to having completed that particular metric, then you would use this as a guide. And AMCH does reserve the right to develop any additional templates, and mostly primarily to provide support to the partners. It really makes it easier for you as partners to report if you do have a template available. So as more information becomes available, or perhaps as requests from the partnership come in, they do have the right to create additional templates. And if that does happen and they require these to be used as supporting documentation, they will be sure to communicate this and share them well in advance before any reporting deadline. So really quick, we're going to go over some of these templates that we discussed, and then after we review high-level information, Zoe will be going over some examples of these and how to fill them in. For your impact analysis template, it does include 4 separate tabs. As a partner, you will only be required to complete 2 tabs, which are the redeployed and new hires tab. This will then automatically feed into the RD summary and NH summary tabs that you see in those templates. These are locked and should not be edited, so please, we ask that you do not try to unlock them or break any codes or anything that's already built into that template, because it is reading from the redeployed and new hires information that you enter. And because those 2 tabs, the redeployed and new hires tabs, will include sensitive information, AMCH PPS will only be requiring that you submit your RD summary and your NH summary tabs. Again, Zoe will be going over an example of what that would look like, and we will show you how your ultimate workbook that you would be submitting would look like with those 2 tabs. Your training templates will have 4 tabs. You'll have an instructions tab, which will already be pre-populated, and you will not need to update as a partner. The training tab, which will have details for each training already pre-populated, and as a partner, you will be required to fill out a separate line for each training session with a different date. And so that would be where you fill in just exactly the same information that's already been provided and pre-populated, and you will just be filling out different rows based on how the different training dates that you offered. Your sign-in sheets will include the same information from your roster tabs, and it'll include information such as employee attendees' names, their titles, any MPI numbers if applicable, and their emails. So essentially, you will want to complete your roster tab first, and then copy on over to your sign-in sheet, print that out, and then this sign-in sheet will serve as your official documentation of who attended your training. Keeping in mind that you do have a training template for IDS E10, but this particular one only requires the sign-in sheet to be completed and provided as supporting documentation for that training metric. Registry and patient engagement templates also include multiple tabs, and that is because you have one template with all the tabs for the applicable project. Again, you will only be required to fill out the tabs that apply to you based on your project participation. Again, you will find these in your Exhibit A and your reporting templates, which ones you have to complete. You are, as I mentioned, again, responsible for filling out those tabs. One workbook can be used for all your applicable metrics using the appropriate naming convention. And you will, again, have to make sure that you list this under the documentation file name for each template in your reporting template. So using Move It to upload documents, Move It will be used by all partners for submission of final documentation on your reporting templates. your monthly and quarterly reports will also be uploaded using MoveIt. When you are uploading, and again, we'll be going over this example, but when you are uploading your documentation, all of your documents must be uploaded in a zip folder. And the folder naming convention will be partner name - reporting period. If it is a monthly or quarterly submission, you will just replace reporting period with the quarterly or monthly submission date. So as you see here in the examples, if you're ABC Hospital, you're submitting your folder for reporting period 3 with all your documents in there. It would be ABC Hospital - reporting period 3. If it is a quarterly or a monthly submission, it would be ABC Hospital - October 10th, 2016. Then once you are logged on to MoveIt, you will also see a page where you have a subject and a note section. In the subject, we ask that you please include the partner name and the title of the submission. So in the example here, again, ABC Hospital, you are submitting for reporting period 2. If it's a quarterly or monthly submission, just include that information. Again, ABC Hospital, and then if it's quarterly or monthly submission. In the note, we request that you please include a list of all the file names that have been included in your uploaded zip file. So now I'm going to go ahead and turn it over to Zoe and Lauren so that they can go ahead and run through an example of how to fill out the reporting training and the impact analysis and partner engagement templates, and run through that example with you. So I am going to hand over.
All right, can you guys hear me on this one?
Yes, we can hear you.
So for those of you who were able to join us on Friday for the workforce reporting webinar, I'm sure you're really excited to have a second opportunity to see these templates. But for those of you who weren't able to, we really want to make sure that you understand what the goals of these templates are and just a quick example of how to fill them out. So I'll try to go quickly. We did record the webinar on Friday. You should have received that on Friday afternoon along with an example of the training template, the impact analysis with some examples within it that you'll use for your reporting. This is the training template, and what we've created here, as the earlier presentation stated, is an introduction or an instructions page which shows you everything that we think you need to know about the training, including what metrics and what milestones it's hitting for the project that you're involved with, the objectives, the description of the training, etc. Most importantly, in the middle of the screen, you'll see staff titles and roles that are required to complete the training, along with any optional staff who are able to complete the training. It's really important that you review this section and that you are aligning the people within your staff group with appropriate trainings for their role. We haven't defined this by job title because across all of our organizations the titles definitely vary and the duties that would be associated with those titles could vary. We've named these by roles for you to define who should be accomplishing these trainings and getting trained. Just to back up for a moment, this training template will be really used when we have a training that we're asking the organization to deliver to their site. So if we have a training that's done through our learning management system HealthStream or through a vendor at a particular location, this will be your responsibility. This is going to be for trainings that we provide and ask you to deliver to your staff within your own organization. Coming to the bottom of the page here, you can see the training schedule. This tells that for DY2Q2, which is our current quarter, this training is required to be completed by September 30th, and that we would expect reporting on the template by the 10th of October, or the 10th of the month following the end of the quarter. And this is the course evaluation schedule. We'll use this to get a training evaluation out to your staff and expecting about 2 weeks after. And I just want to, there's a couple folks with their lines unmuted, if you can mute them. Then we've got a PMO contact, so if you have any questions about the training itself, you can contact this person. Any questions about reporting on the training template, you can certainly send to the DISRP email or to myself directly. And then to make this a little bit easier for you, because this is kind of a specific way to report, we've got how to submit reporting specifically for the training template at the bottom of this instruction page. So you've got your reporting manual and you've got the website with a lot of additional resources, but you can always come to the front page and figure out how to name this file, etc. Let's walk through the tabs that you're actually going to be using. The training tab is going to show a list of every time this training was offered. And so the PMO will provide the information here that I've just highlighted, which speaks to what the training is, the description and the materials, etc. And if this training was only going to be offered on one day, you would simply enter the day of the training and how many of your staff were trained on that day. We know, though, that in a busy practice, it may take several attempts. You may have people reviewing a video on their own or working in small groups. So this training may be offered on multiple days. And if it is, what we need you to do is copy and paste this information, any number of lines below that would represent the number of days on which you provided the training. And then you would simply include in here the dates that the training was provided. Coming right down the line here. And then for any date the training was provided, we need you to indicate for us the number of staff who were trained on that day. We had 20 people trained between the 2 days. Now, to further kind of validate this information, we have 2 additional things we need you to fill out. And what I'm going to do is jump to this roster tab. This is going to be the best place to start for you. What we're going to ask for you to include, and I'm going to apologize, this template example got a little bit mishmashed in a couple of different communications. What you'll see on the official template that we send out is the employee name, title, email, and the NPI number if it's a provider who's being signed up. And so what we're going to ask you to do is enter your employee's information. And over here you'd have an NPI number. And you'll run these down. You'll pull in a number of different employees, however many employees are in your organization or in your unit, depending on how you are sending out this training. And what you'll be able to do is you'll be able to copy and paste this information from the roster to calculate the sign-in sheet here. The sign-in sheet is going to be used as a printable document, so you can see that this page ends here. And when we go to show you a print screen, it should print to 1 page. You can see this here. This will print out to 1 page. You're going to fill out all of the employees' information based on the roster. That's going to assist us with some legibility so we understand who it is that's being trained. And you're going to enter the date of the training that's being offered. You're going to print the document, and then you're going to have each employee who obtained the training sign the document. After all of your employees have taken the training and have signed in or signed that they have taken the training, whomever you have assigned to do so is going to attest to this training having been completed by the people listed on this sheet. So why is this roster tab important? It seems redundant. Well, the thing is that the sign-in sheet also is and can you please mute your line? Sign-in is going to be printed, it's going to be signed, and you're going to send it in as a PDF. And that's a counter direction to what we've heard before, so I just want to be clear. This is an Excel document, but this tab in particular printed, signed, and scanned back as a PDF. So that's why we need the roster completed as well. Again, I apologize, this view is not perfect. It should have an NPI field here too. And we need those employee emails electronically so that we can deliver the training evaluations. And we need the NPI numbers electronically so that we can report on your provider's training activities. So these are the 4 tabs for the training template. Coming to the impact analysis template, this is really what New York State is looking for in terms of understanding the impact that DISRIP has on the healthcare workforce. So what they're looking to understand is the folks in the PPS are newly hired to perform DISRIP-related activities, staff who are redeployed from one job to another to support DISRIP activities, and staff who are retrained either for redeployment or if they're at risk of layoff. So what we've done is created a spreadsheet that has 4 tabs, but as we heard earlier, we're really only asking you to look at these 2 tabs, the new hires tab and the tab. These summary tabs we'll take a look at, but there's nothing that you need to do here other than copy and paste them when they're complete. We already have a couple examples built in here, so you'll see that this is the new hire tab, and these are new hires who have been hired as a result of this trip. So again, on Friday, we sent out the 48-minute reporting video along with some supportive documentation. And coming out a little bit later this week, we'll have an FAQ document that explains some of the definitions for new hires, et cetera. But for today's purposes, these folks have all because there was a need within the organization as a result of disrupt for additional staff. So their employee information has been included here, the name, date of hire, the original facility type, and their job title and disrupt job title. So we've got a couple drop downs here, and these are important for a couple of reasons. The original facility type is going to be the facility type that falls within one of these 10 reportable job facility codes. These are defined through the compensation and benefits analysis, so you've already identified yourself under at least one of these organizations. And this is important because these are the only 10 job facility types that we can use for reporting the impact analysis to the state. Your organization may have more than one, so it's important that you select the correct one for the correct person. As an example, an organization may have an inpatient area and a private provider practice. Please make sure you're choosing the appropriate one for the appropriate staff person. The job title here is the job title that's affiliated with your organization. It's their unique title. That's why in column F, they're asking you for the disrupt job title, which will be one of the 65 job titles that's approved by the Bureau of Labor. And so you'll find within the template a long drop-down. We alphabetized it to try to make it as helpful as possible. But we need you to select one of these that most closely resembles the job duties of your staff person. To help with that, I received already, but we can certainly send again a PDF document that was provided that shows the job titles and also some brief job descriptions from the Bureau of Labor that will help you associate the person's job title with something that matches one of the 65 approved titles. Again, this is important because we're only going to be reporting under those 65 titles and the top 10 facility types. And we asked you for the original FTE and the percent supporting disrupt because we're just trying to get a sense of really what the effort is that's needed for additional work produced by disrupt. If you cannot provide for us a guess of the percent FTE supporting disrupt, that's okay. This is an optional column, but we'd like you to take your best guess if you can. All this information is going to roll up to this new hire summary information, new hire summary tab. And so what this is going to provide for us is the information that we need to report, but it's going to exclude any information about your employee that we do not want, such as their name or salary information, which you'll see on the Redeployed tab. And that's important because you don't want any personal information from your staff person. So again, those examples carried right over. You don't see the person's name, but you do see their original facility type and their job title and their disrupt job title. And information for us at the bottom to let us know how many new hires in fact were brought on as a result of disrupt. One more tab, the Redeployed tab. So this is looking at staff who have been redeployed from one area of your organization to another to support disrupt. As an example, you may have an inpatient staff nurse being reallocated or reassigned to a position in your practice to perform care management or care coordination activities. So we've got Sam Smith here, who was working as in the inpatient unit. Again, you've got 10 facilities here. The original or institutional title of the person, the transportation or transport specialist at your organization. And so under the 65 job codes, we've keyed them in as transportation. In person, their original FTE, and their original salary. This is important information for us, and you'll see why in just a moment. The date of redeployment, their new facility type, new title, new disrupt job title, same categories you saw in the previous part of this worksheet, but now we're looking at the new information. Is this a new position or a replacement position? Really the only way we're going to be able to identify true new hires because we're not actually going to be capturing any terms in the process. Is this person full-time, part-time, or their new FTE? And if you can, again, or provide an estimate of their percentage FTE supporting district, that's great. And then their new salary. So we don't want the salary information, but we're asking you to fill it out on this sheet. And why is that important? These green cells here, these green columns, FTE variance, salary variance, and placement type, are what we're going to provide to the state. We're looking for an understanding of the placement type that staff receives, or that they're subjected to when we're redeployed. And what this means is that based on their previous salary and their new salary, whatever the difference is between those two things, this person could have enhanced placement, full placement, partial placement, or less partial placement. So enhanced placement is if they're receiving a salary beyond 100% of their previous salary. If they're receiving greater than or equal to 95% of their previous salary, they are considered a full placement. Partial placement is greater than or 5%, less than or equal to 95%. And anything below 75% of the previous salary is considered a less than partial. So these are going to auto-calculate for you simply by putting salary information in there. Just ask that you don't change any of these cells here. These are auto-calculating. We can't lock them because it'll lock the whole sheet. We need you to be able to fill in this information. So please just don't do anything in these cells. And then we're going to ask you just a simple yes or no question. Was this person retrained in order to be redeployed? Yes or no? And again, what that's going to do is come up to the RD summary page, and now we've got all of this information about your employee. We can summarize this and we can aggregate it through all of our organizations, but we haven't gotten any of your employees' confidential information. So this new hire sheet and this redeployed sheet are really just for you. These are for tracking purposes. So if we come back to you and we say, hey, we need a little bit more evidence about this new hire person, you can go back and say, okay, that was Sam Smith. You want to go back to that person's employee file and find out a little bit more information. What we're going to get from you here is just simply a list. The ID even is optional. So this may be left blank. But we're going to, we may come back to you and ask questions. This is just, again, for your record keeping. How are you going to submit this? We're going to ask that you take the new hire summary and you copy and paste it along with the redeployed summary into a new document. So what you'll do really is just highlight this entire page. You'll copy or Control-C. You'll find a new Excel file, and on one tab, paste your new hire information. You'll come back to the impact analysis and grab your redeployed summary, copy it here, paste it into a different tab within your new document, and paste it here. And then all you're going to do is save the document using your naming convention that's provided in the reporting guide. So for this one, we're going to say ABC Hospital. And IDS R8. And the date that you're expected to. And you can save this to wherever you want within your computer and then upload it to move it as you will the rest of your documentation. Again, I just want to stress that the only thing you'll do differently here is the sign-in sheet for your training template that will be printed. We'll expect that all of the sign-in sheets that you use for your organization will be scanned into one file, one PDF file, and we'll receive one scanned copy through Move It as well. I think that's it for our templates.
Perfect. Thank you so much, Zoe. And we will open it up for questions after the presentation is over. Was there anything else that you had to cover in this section? Zoe? No. Okay. So we're going to go ahead and continue the presentation. And so this is where we now start going through the reporting process. We will go through each step from how to review the template, gather some supporting documentation, complete your reporting template, and then ultimately upload to move it. And so Joe from AMCH will actually be going over the final step, which is uploading it to move it, so that you all can see how that process works as well. So right now what you see on my screen is essentially an example of a reporting template, just like the one that all of you should have received by now. You see that there are 4 tabs. You have an overview and instructions tab, which really just covers, highlights, gives you information about how to fill out the reporting template. It's a quick go-to tab. The same information is found in your reporting guide, but this really is just how to complete this particular template. Then you have some key definitions that are related to the columns that you find in this template and other information that you would see. All of these are locked, so you will not be able to change anything. And again, please do not try to unlock these workbooks. Then you have your signature attestation cover sheet, which is what we discussed earlier. So this is the one that you will have to fill out and then sign and date in order to upload into Move It for your final submission. And so what you see here is actually a print view. What you want to make sure is that you are capturing the entire attestation cover sheet so that once you print, it'll all be on one page. And so, of course, you would go, select print, you would print it, sign it, date it, and then have that scanned in and uploaded as a PDF document. Then we get into the actual reporting template. So in just to put it out there for this example, I have hidden some columns. So if you see dollars that don't align with totals, it's because I've hidden columns for easy, so that it's viewable for all of you on the webinar right now. But we have an example here for ABC Hospital. And so what you see here, I'm going to go over the information that you would essentially want to verify, make sure that it's correct. So of course, making sure that this is your template. So your organization name will be found up here at the top. You will also have received it saved as with your organization name. You will have all of your project IDs listed and your project name that you chose. So depending on which project you are essentially signed up for, that is what would show up here. This information should also match up to what you have in your Exhibit A. You then have your reporting template broken up into 3 separate components. So you will find all of your performance metrics in Section 2. You will then find all of your engagement metrics under Section 3 and all of your reporting metrics under Section 4. The columns you will have, you will also find similar columns and similar information to what you see in Exhibit A. However, this one does have as well a little bit more detail. So you have your reporting period included. So when this, again, as we mentioned, based on the reporting period, that's what would trigger payment for this particular metric. You will have your completion date. Again, please keep in mind that some completion dates have changed due to state requirement changes. So please always refer back to your project activity schedule. And for the most part, if these have changed, they've just essentially given you more time for completion. So just keep in mind that you always want to also revert just back to your project activity schedule. You will find a drop-down menu option. So the gray cells are the only ones that are fillable by you, the partner. You will have, if it has been completed by the PPS defined completion date, so if you could complete, for example, this one by 7/31/2016, you would select yes or no. And then you would enter all your supporting documentation file names into this particular box. This is where we will also go through some examples right now. So just really quick for this particular metric, it's your completion. You should have completed the metric by 9/30/2016. You would say yes. I don't know why I can't do that. So you would select yes, and then you would enter the supporting documentation file names in here, following the naming convention that we have discussed, and that is also found in your reporting guide. You will also find the value that is assigned to that particular metric. And so then you will know that once that is essentially graded by AMCH, that is the payment that you would be receiving for that metric. This again should also align with your Exhibit A's. You should find the same values as you have per metric in your Exhibit A's. Then we move into a section which is again for AMCH purposes only. So this will not be available by you as a partner, but you will see information for reporting period 1, where it is essentially the estimated dollars that you will be receiving. This should be adding up to your total dollars based on the value of the metrics that are assigned reporting period 1 and have been already graded by AMCH. Again, this is not fillable by you as a partner. Please do not try to break or unlock any of these sheets. So what I'm going to review now is essentially what you will see that has already been completed by AMCH. And so again, we discussed that reporting period 1 has already been done. You should have received your template with this information already pre-populated based on what you have as a partner completed and submitted to AMCH by the completion date. And so anything with a reporting period 1, you will not be able to edit at all. So all of these you will see that are also locked. So you will get a message that you are unable to change that. You will see that it's either been completed or not. You will see if there is any supporting documentation files that were aligned to it. And this is a section where you will see either green, red. You will not see yellow in this particular reporting period. But in future reporting periods, you will have red, yellow, or green. And so essentially green will mean that you completed the metric, AMCH has reviewed your supporting documentation, and it truly has been completed. Any information that they are providing would be included in this box, and then who reviewed it. So in reporting periods 2 and 3, what you might see here is a yellow or a red box. And during the remediation period, this is your opportunity where you would have to address any comments that are included in this in these boxes for your metric. As you see here, ABC Hospital, they completed this metric for reporting period 1. They truly completed after review by AMCH, and so their dollars will ultimately be totaled up at top. And it is the same for all of the different, for performance engagement and reporting. So then what we're going to review now is an example of a metric that is due in period 2. And so here, this particular metric has a completion date of 9/30. And for this one, what you had to provide, according to your reporting, to the project activity schedule and your reporting guide, was you had to prove that you held a meeting with a potential CBO or external stakeholder for future partnerships and collaborations. And so what has been asked for this particular example would be a meeting agenda, a sign-in sheet, and then any notes or minutes from that meeting that occurred. So something that we also included in the reporting guide we want to call out right now is that as well, when you are gathering your documents, if there is a date you're trying to prove, so essentially here in this example, you're trying to prove that you had this meeting prior to or by 9/30/2016. So what's also helpful is when you are gathering all the documentation for you to highlight this information within the document. And so for this metric, I'm going to pull out what that would look like. So we see that this is 3VIP1. So I have already saved this as one PDF document. And you see here that I am ABC Hospital. I had my meeting with XYZ CBO. This is my agenda. I held the meeting on August 18th, which means that I have met, fulfilled by the completion date. Again, with XYZ CBO, I have my agenda. I have my sign-in sheet. I listed out the information that has been requested. This is very much similar to the training sign-in sheets that you saw as well from your template. Then you have your signatures. You have highlighted the date. again, to prove that you have met that particular metric by the completion date. And then finally, you submit any notes from that or minutes from that particular meeting. So this is, again, one PDF. You have saved it using the naming convention that has been requested. You would then go in, say, yes, I have completed this, and then enter the name, your document name into the supporting documentation file name column. And so here you would see that this particular metric, if completed and accurate, it is worth $28,592 for dollars for ABC Hospital, and so that would go into their reporting period 2 total. So then I want to go over an example of a metric with an attestation. So here we have 3DIII_P5. So here you just want to demonstrate that you have adopted asthma evidence-based guidelines that meet the AMCH PPS standards, and they have been adopted by 8/31/2016. And so this is the example that we discussed earlier where you have an attestation template that you can use. And so you'll see here that, again, the attestation has been already completed. It has been signed. You have your project metric ID up at the top. Again, you have highlighted the date to demonstrate that this was signed and completed by the completion date. You have scanned it and created a PDF. Again, the name of the document included in the supporting documentation column. And so that one is included in here as well. And so now what I want to go over really quick is also so we discussed these other types of metrics that might have quarterly or monthly reports. And so even though the examples I will be going over are not essentially due until reporting period 3, so you would then complete this in reporting period 3. But what you see here is that I have some metrics that are patient engagement metrics. And so what essentially you would have to complete here as a partner is that you do have 3 separate completion dates. So 10 days after these completion dates, you will have had to submit your patient engagement template. And again, if you have more than one metric, which this ABC Hospital does for patient engagement, they have that 1, 2, and 3. And you will see that while they have been submitting all of these templates through the process as when they are due, 10 days again after your completion date, you cannot essentially trigger a completion. You would not say yes until your reporting period 3 comes around and you have truly all of these templates already. So that is what you would then be able to say yes. And then you would again include all the templates that you submitted and those titles. So here, ABC Hospital completed patient engagement template with the completion date. So because this particular metric, this particular template was used for 3 metrics for ABC Hospital, this same information that you see in the supporting documentation file would be included for all of those metrics. So again, this particular one, you would say yes, completed, because you did complete all 3 required templates, and you would list them again for that metric, and again you would list them again for that metric. And so that information is found here. And then finally, the other example that we would go through is another one with the same concept as your patient engagement. This is a workforce impact analysis that you would then have to complete on a month. For example, here it's a monthly basis. Again, you would not say yes, you've completed it until you have submitted all of your monthly templates, listing the template per month that you have submitted with your final submission on the reporting template. And so again, just a reminder, overall that your completion dates, you will want to verify with the project activity schedule, making sure that that is the ultimate completion date. There have been a few that may have been changed, giving you, for the most part, about a month longer for certain metrics just to have those complete. And keeping in mind that anything is that when you do have quarterly or monthly submissions, you do not have to, if it does not align with a reporting period due date, you do not need to submit this reporting template. You only need to submit the templates or the documentation that is required for that particular metric, and that is due 10 days after your completion period. So now what we want to go over is essentially how you would create a zip folder. As we walked through, I had everything that I needed. I have completed my my actual template already. So another request is that you please do not save as your templates. We do not want the names to be changed based on how they were sent to you already. So we request that you please only save. You would then close your template. So what you see here is I essentially I'm pretending that these are all of my reporting period 2 documents that I have to upload. So as you can see here, I have also included my reporting attestation cover sheet. It has been signed and dated by the appropriate individual, printed and scanned in PDF. So then what I go ahead and do is I select all of my documents. You right click. You send to. And you compress zipped folder. And then we request that you would follow the naming convention that we discussed earlier. So ABC Hospital dash, and this is for reporting period 2. And then this is what you would ultimately then upload to move it. And so now what the next step is, of course, the upload. So I'm going to go ahead and hand it over to Joe at AMCH to go ahead and walk you through what that process would look like. And then after that, we will go ahead and open it up for any questions. So Joe, I'm going to go ahead and let you share your screen. And as a friendly reminder, folks, if you could please just mute yourselves if you are not talking, just because it makes it a little bit more difficult for individuals to hear if they are trying to listen and we have some background noise.
All right, good afternoon, everyone. Can everyone hear me okay?
Yes, we can hear you, Joe.
All right, fantastic. So the first part of going into Move It and submitting as a guest would be going to sft.amc.edu. As you can see, here's the login screen, and then there's the Register and Send Files button beneath, which you will then click, which brings you to this screen. Now for the recipient email, for this one, I'm using my own login, but you'd use the one designated to you from authorized Move It users at AMC, and then you put in the email address that you are sending from, and then you hit Register and Send Files. After that, this screen will come up, indicating that indicating that an email has been sent to you. From there, one moment, too many windows open. So this is what the email would look like from Move It, indicating your username and password to use. You will then click the link that appears, and it'll auto-populate your username, and you will type in the password provided, which will bring you to this screen. Now for this screen, we're currently recommending as best practice that you do not install the wizard, so you would click one of these buttons. For me, I'm disabling for this session. And that then brings you to the Send a Package screen. Now from here you can see the to and from are already populated. For the subject, the naming convention is in the user guide. For this example, I'm going to type ABC Hospital -test1. And then for the note, test of move it. Now, as you can see in my right-hand column, I've got two very important documents that need to go up, and they have been combined into a zip folder already per the workflow that the COPE team just went through. For uploading files, you will click Choose File, and then select the file that you want to upload. So at first I'm selecting the zip file for reporting period 3. Now, if you weren't combining them, and we are recommending that you do, you can click Add Another File and another box will come up. From there, you just confirm the upload by clicking the Upload button. It'll say Attachment Added up top, and then if you are all done typing your note, you would hit Send. And you'll get this screen indicating that package has been sent successfully. Now, partners who've already submitted data to the PMO, please note that the guest registration process is single use or a burner login. You will need to use this procedure to generate a new guest login each time you submit data. All right, and handing it back to COPE. Thank you.
Thank you, Joe. So essentially what we want to do now is go ahead and open it up for any questions. We have received a few, just probably 2, through our chat. And so in order to keep this process at least streamlined a little bit, we're going to ask that if you do have a question, please go into your chat box on GoTo, and then just press 1, and we'll go ahead and call out your name as it is your turn to ask your questions. So we're going to ask, we have a few questions that came up. So the first one is, we had a question in, what are the requirements of a quality assurance officer? So we went over this a little bit in more detail through the presentation, but essentially what we're looking for is somebody who has ultimate accountability, making sure that they are reviewing that documentation, making sure that everything aligns with what you're attesting to as being submitted and completing the metrics. So that's what we're ultimately looking for. It does not necessarily have to be a clinician or anything of that nature, but just somebody who is keeping that extra eye out for things. So, and I'm going to go ahead in just a second, everyone. Okay. Sorry about that. So then, does that answer the question? That question came from, from Robbie. Okay. If anybody else does have any other questions about that particular one, please just let us know, and we're more than happy to answer to that. Now, I am going to ask, so Lauren, did you have anything else to add to that particular to that question, or what you might be looking for more detail from a quality assurance officer?
It's really like what you said, just a second set of eyes. We just want to make sure that everything that's being submitted is accurate and valid, and that our partners are doing their due diligence on their end. So I think you covered it.
Thank you. The other question that we got earlier was, we are offering training via HealthStream. It is not possible to collect individual employee signatures. Will reports from HealthStream be acceptable? I am going to turn this over to Zoe in regards to what you will be accepting, but it is my experience beforehand where you are doing webinar type trainings that is acceptable. Please go ahead and chime in, Zoe, if it's any different from that.
Yep, so we actually reached out to that participant directly. We believe that should be just fine in terms of reporting completion of training activities. We do want to check with the IA to make sure the state will accept that as validation documentation. But I also told that participant that we do still need the training tab to be completed, and we'll also need the roster completed, because we'll need, unless there's a way to get that through HealthStream effectively, we do need the NPI number for the providers receiving training and the emails for all of your users receiving training, so that we can send evaluations. And we'll send out clarification once we do hear back from the state on if that's acceptable. I know we have a couple organizations using HealthStream or other learning management systems. I did want to just state, I neglected to do so earlier when talking about the impact analysis, so not to confuse things too much. I know that question was about the training template, but in relationship to the impact analysis template, we received clarification from the state yesterday that said that the reporting for the impact analysis will be based on EY2, Q1, and Q2, which means that the reporting period is only 4/1/2015 to 4/1/2016 to 9/30/2016. Our previous guidance said that it would be all of EY1 and including these 2 quarters of EY2, but right now our understanding is that you'll just be reporting on this year's impact EY2, Q1, and Q2. And we'll be sending out an email. Again, we want to double check that clarification, but we'll send an email out. We just have somebody ask to repeat.
All right, I know where it is.
Thank you. Thank you, Zoe. So we're going to move on to the next question, and we have a question here. I have a question here from Kelly, and I think what it comes down to is if you participated in a webinar that was held by the PPS and that fulfills some metrics that are that are applicable to you, and you have to submit documentation. You're asking about what type of supporting documentation you would have to provide. And so for those type of webinars where, let's say, like today, for example, we are keeping track. So we have a list where we'll be providing that to AMCH as well so that they can check off who did participate. Now, it is my understanding as well that they have been requesting within 24 hours that you please submit the names of the attendees on that for that particular webinar or training. So I am going to let Lauren chime in here to see if that is also something that they will be requesting from this one. And this question was specific to a CBO webinar. So if I'm capturing the question wrong, then please go ahead and let us know. And if not, if Lauren also can chime in on those requirements.
Could be wrong.
Should we have a column for PPSS and a column for MSC separately and then added together?
No, it's not much. It's only a couple $1,000.
Okay. I think I can hear somebody, but I'm not sure if that was part of the question or.
They have site-based. I think I'll make the site-based say SC.
Okay.
Can you hear me now, Margarita?
Yes, now I can hear you. Yes.
Okay. All right, sorry. So anytime the PMO has a webinar, this webinar, for example, yesterday we had a CBO webinar, we have a cultural competency training coming up, the PAP webinar. Anytime that we have any webinars that apply to your contract metrics, we do ask that you email the DISCRIP email. It's discrip@mail.amc.edu. within 24 hours with the name of the person that attends and the organization that you're from. We typically, right now we're using GoToMeeting because COPE is really facilitating the call, but we usually use WebEx, and at this time we're requesting that as backup documentation. We're working on a process to eliminate that function, although it might not be eliminated completely for people that call in, for example. We can't see your name or your organization. But for now, yes. Email disrupt@mail.amc.edu with the name of the person attending and your organization, and you will get credit for those webinars. Without that email, we cannot give you credit.
And so just to add on to that, what I would recommend for you partners in relation to that is also save a copy in your records of the email that you sent, just so that if for whatever reason it didn't go through, technology can be interesting sometimes. So I would personally also save a copy of that email the day that you sent it, and then go ahead if it does, for some reason an audit or something comes up, let's say Laura needs to reach out, make sure that actually was submitted, then go ahead and just save that in your files.
Perfect,
so
Thank you, Margarita.
Yeah, of course. Then the next question, and this is for you, Lauren, what dates are the invoices due?
So the dates for the invoices, well, it depends when you get your report in. As long as the reports are in by the due date of the 10th of the month, let's start with reporting period 2, the one that's coming up, 11/10. So you submit your report, we do our remediation period. You should submit to us your invoice immediately following the return of your reporting template. So right now you were all emailed the reporting template on the 14th that said reporting period 2, I believe, or period 2. Once we have a chance to quote unquote grade those and send them back to you following remediation, they will be saved as period 3. That should really be your trigger to send us an invoice. However, I will say that several partners have asked me to send out a template invoice. So I will be doing that again, as I did for period 1, with all of the metrics for period 2. They may be applicable to you depending on your contract, and some may not. So you still have to reference your Exhibit A. But shortly after, so I would say right around the 20th, you should be submitting your invoice, November 20th and January 20th.
Perfect. So the next question, can we have copies of the slides? And I think this may have come up twice. These were attached onto your invite, and Lauren and team can also email them again after this webinar. We will also be making a recording available on the site that you see here on your resources, PowerPoint slide, and so that will also be available there. So does submitting a reporting tool replace submitting an invoice? And no, it does not. Do we need to resubmit documents that we previously submitted? No, if you already essentially completed that metric and AMCH has not requested that you resubmit those, then you would not need to do that. The webinar slides are available. So there's another question, what documentation do we submit to the state that we met that metric? For example, the CBO webinar, we don't have a sign-in sheet. So you as partners are not submitting directly to the state. That is why AMCH is gathering all the supporting documentation that they need so that they can then report to the state as a PPS and complete whatever their requirements are so that then they can draw down those funds that they are flowing out to you as partners. Now, Lauren, please correct me if there are some other requirements from partners where they're reporting directly to the state for your PPS, but I do not believe there are.
Nope, absolutely not. We take care of all the reporting in-house, which is why we set up this process the way we did, so that we could get the information directly from our partners, and we are the liaison to the state.
Correct. And again, that's actually, a good question, a good point is that's why we are being so cautious about, making sure that we do have somebody attesting to the accuracy and, everything with your supporting documentation, because this is essentially the information that that we would be completing, and drawing down our funds. So another question, when will we be receiving the first required reports completed for us by AMCH? So those are your reporting templates for reporting period 1, which would be, that information is included in the templates that you should have received on September 14th. If you have not received those, or if the point of contact at your organization has not received those templates, please email Lauren at ayersl@mail.amc.edu. Let me see where. So we're just going through all of these questions, making sure we're capturing. Going back to that. Don't mind to submit to state that we met the metric. Oh, okay. So the CBO, we're going back to if you don't have a sign-in sheet. So I think we answered that question, how that will be addressed. So, AMCH will be keeping track of attendees. An example here also today, we will be providing that list of who attended, and then also requesting that you please email AMCH within 24 hours of your participation in any webinars. And I think we have, email this one. I think we have answered all the questions that we received. If anybody else has a question, please, as I mentioned, just type 1 and you know, your line is open, or if you want to submit it through the chat, please feel free to. We are actually on track with time. We have about 4 more minutes, and we're happy to stay here and answer any additional questions. Also, Lauren and team are on the line as well, so they can also answer questions you might have. Well, and if there are no more questions, as I mentioned, we can stay on the line as anyways, but we do appreciate your time today. There are additional resources, as we mentioned. You have your partner reporting guide, activity schedules. You have the link to the site where you can find the templates and additional information. We will be providing the PowerPoint from today, the presentation, and also the recording. And as always, Lauren and team are available for any questions. We do ask that if it's related to partner reporting, just please put in your subject line phase 1 partner reporting question so that they can triage those appropriately. Thank you all again for your time, and Lauren, and be on the line if there are any more questions, and we'll be here till 2:30.
Thank you, everyone.
Okay.